Hi, friends. Thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. Today's interview is going to be awesome. I have been looking forward to it for a while, and I'm just thrilled to welcome our guest, Patti Andrich, to the podcast. And also my friend and fellow brain injury coach, Kaylee Blair, is going to help me co-host again. So Patti is a clinical manager, business owner, occupational therapist, and certified optometric vision therapist. Patti is internationally honored vision therapist, researcher, and author. She's known worldwide for her success in treating children and adults with sensory and motor processing disorders. She was named Vision Therapist of the Year in 2020. Patti received her master's degree from the Ohio State University College of Education and her occupational therapy degree from the Cleveland State University. Additionally, Patti holds certification in auditory processing through advanced brain technologies. Patti is certified in INPP-permitted reflex integration techniques, having studied in England under the direction of Sally Goddard at the Institute of Neurological Physiological Psychology. She received her certification in vision therapy through the College of Optometrists in Vision Development. Today, she serves on several advisory boards relating to vision in the United States and in Asia, and is a member of the National Academies of Practice, the International Sports Vision Association, the Optometric Extension Program, and the Neuro-Optometric Rehabilitation Association. Patti Andrich is the founder of the Sensory Foundations Program, a neurosensory motor program that helps adults and children integrate active primitive reflexes and gain postural stability. Patti specializes in improving the lives of individuals with attention, behavioral, coordination, visual, auditory, anxiety, vestibular, and/or emotional regulation challenges. That's an impressive bio. I'm so excited to have you with us today, Patti. Thanks for being here.
Oh, I'm equally excited, and I'm so honored to be on your show. And I do follow your show, so it's really cool to be a guest on your show.
Oh, wonderful. Thank you so much. I really am excited to bring you on and have this discussion about primitive reflexes. I think this is an area that is maybe not as well known as it should be. So let's bring some light to it. But first, I would love to start by hearing how you got your start in occupational therapy and then vision therapy. I don't know what order those came in, how that happened, but tell us about your journey that brought you to where you are right now.
Sure. Well, it's definitely God-led. That's for sure. My journey, I guess you could say, we all pick professions that help ourselves and help our own healing. So I had a bit of a traumatic childhood. So there's that. I also had a bit of trauma in sports. So I was a gymnast, and I remember my very first concussion that was significant enough to realize it was a concussion. I was jumping off the back of a horse where girls vault off of these things called horses. They're not real horses, but that's what they called them. And so I stood up on top of them, and I was doing backflips off of them to train a trick that I was working on. And I under-rotated and hit the underside of this vault, and I blacked out, and I saw the stars going around and all that. And that was probably my first known concussion that was pretty serious. Of course, this was back in the 70s, so you just shake that off and you jump back on and you go again. And so, as you know, as our listeners know, when you have one concussion, you end up having multiple concussions throughout your lifespan. So that was just the first. But In any case, I was a gymnast, which led me to cheerleading. When I was in college, I was dropped in a stunt and broke 3 bones in my back, and probably hit my head again during that too. And this was in the early late 80s, I would say. And the doctor that saw me didn't even want to x-ray me, and I had 3 fractures in my back. I actually went home from college at that point not knowing I had fractures in my back, but I couldn't get out of my car. Went home, and then I ended up going to the emergency room and found I had all these fractures from that fall. So I've had a lot of injuries that way. When I was at Ohio State, my degree was in education, so I was studying education, and I was a pretty good student for survival reasons. I really needed to stay out of my home that I grew up in, and I needed to have a career. So my parents told me I was going to be a teacher. So I said, fine, I'll be a teacher. And I have come from a long lineage of teachers. So my teaching background is strong through my blood. So I went into education, and I decided to do adapted physical education. So I worked with individuals with special needs, which I could really relate to because at that point in time, I couldn't even read. So here I am, even at age 19, not knowing how to read. Now, I could read words, but I couldn't read a book. My visual system was pretty skewed, probably in part from all the head traumas I had growing up in sports. But words would move off the page. So I would look at the words and they would just go off the page. So I became very good at taking tests without even reading tests. Uh, I figured out the system. I figured out patterns. I figured out just ways to compensate. And I did graduate cum laude from Ohio State.
Amazing.
Yeah,
Wow.
I had some moments like to put myself through school, I cleaned homes and I nannied. And I had these 2 wonderful little girls I nannied, and they were twin girls. They were 2 years old at the time. And they said, Miss Patti, can you read a book for us to go to bed? I said, sure, not knowing how to read. And so turned the pages and I looked at the pictures and I made up a story. And these 2 year olds looked at me and they said, Miss Patti, you don't know how to read. I'm like, 2 year olds called me out. Other people did I not fool? Like, I was like really kind of embarrassed. Like, I thought I was putting on a show that nobody could see my issues. But here the world was just gracious. And I don't know, I had friends, so I don't know how that all worked out. But in any case, I did get a pair of glasses, and that was the first time I could actually put some sense into things. I got a pair of glasses that made things bolder, and I asked for tint in my glasses because I realized that when I sat outside to study to try to look at my notes, which were chicken scratch for sure. But when I tried to look at them, I did better if I had like a brown tint in my sunglasses. So I would go outside and study in sunglasses with sunglasses over top of my other glasses that the doctor gave me, just the bold things, right? And so I did, fine. I graduated from college, and I started working as a consultant for the state of Ohio in special education because I had my master's at that time in special education. So I worked at a center called NeoCirc at the time, and this was a Northeast Ohio Regional Resource Center that doesn't exist anymore. They've replaced it with some other things. But in that job, I did a lot of presentations. I helped to create the state standards for an IEP for children, and I learned how to give lectures, and I provided all kinds of just crafts and things for teachers to include children with disabilities in the classroom. So I got to that route. And then I decided I wanted to try getting my PhD. But my boyfriend at the time, Dr. Alex Andrich, said, how about we get married instead of you traipsing off across the country to get your doctorate? So I said, that's fine. Let's do that. That sounds like a fun. We'd been dating for a while, so I was pretty happy for the question to be popped. And so I said, well, I need to go back to school. And because I already had a very strong background in pedagogy in education, and I had a strong background in gross motor development through adapted physical education, I decided to go to occupational therapy school. And then I was like, whoa, this is amazing. Game over. Occupational therapists are really awesome. Yes, they're so cool because they can specialize in their own personal passion and help somebody else live a better life, whatever that personal passion is. And and so it's been wonderful. My personal passion was really finding my vision. So I started in occupational therapy school. I started learning about the visual system a little more in depth. I did some just dissecting the human brain and the visual system and learning about how the brain and body work together through the visual system. And I was all of a sudden able to have conversations with my husband that I could not have before because we understood the visual system anatomically together. And so, yeah, so I started doing that. And then my husband's like, we should go into business together. So I started with my husband the vision development team, which is actually started as the Andrich Eye Clinic, but we're not very clinical. We are actually really more therapeutic in what we do. And our patients renamed us. They said, you're not clinical. You are a team player, like beyond what I've ever seen before. So our patient base actually retitled our practice and called it the vision development team. And so that's where I work today. And I help to run and organize and train our therapists to teach vision skills. So, yeah, that's kind of the story.
I love it. That's amazing. Thank you so much. I'm curious, what is your husband's job? Like, what does he do?
Yeah, so he's a neuro-optometrist. So he does all of our vision exams. We have a couple other doctors that work for us and alongside of us. But the neuro-optometrist will do an eye exam on the client. I like the word client. I do mix it up with patient and client. But you know what? I just feel the word client gives so much more self-respect to the individual I'm working with, where a patient perpetuates their sickness or their illness or their just disease state, or and many of our clients that we work with have already gone through their disease state. They've already gotten the medical side of things taken care of. And so now I really just feel honored to be working with them. So I like to call them clients. So yeah. So the client comes in, gets their eye exam, but we're doing some more in-depth eye work than most optometrists will do. And we're really looking at the nervous system. How does it work with the visual system? The visual system should lead all of our senses. So we're sensory integrated beings prior to a brain injury. After a brain injury, our sensory systems are disrupted, dysregulated. And vision is kind of that leader and that glue that makes sense of all of our other senses. And so, yep. So he does the eye exam, sends them to the therapy department, and then we do a lot of treatment. And my background is how best to help somebody start where God started. And I like to go through the earliest neurological connections that we can tap into, which are primitive reflexes, and build the visual system that way. And I just use natural development to kind of be my guide in what should be first, second, third, and fourth in the progress.
Yes. Oh, good. Oh, I'm so excited to jump into this. Really quick question though, first. So did you get your training in vision therapy after occupational therapy?
Yes.
Okay.
And I got my training in reflex integration after I became a certified vision therapist.
Okay. I see the progression here. And that makes sense because I feel like with OT, especially like I was introduced to the concept of primitive reflexes in OT school, but it was very brief. Like everything's very brief. It's like, here, let me introduce you to everything you could possibly work with. And then it's like, okay, once you're in the field, then you can go and get more training or like specifications. So it makes sense that that's kind of the path that you went on there. So I love that little intro that you gave already to primitive reflexes and why, like using the way that God used it, right? So this is again a topic that I think doesn't have as much attention and focus placed on it as it deserves. And so I'm really happy to be sharing this with people who are listening so that it's on their radar, they're aware of it. So can we start by having you just kind of explain on a really like a high level what primitive reflexes are and what they have to do with brain injury?
Yeah, so I look at Primitive reflex is like a coding system. So if anybody's familiar with like a computer program of any kind or a game of any kind, someone had to code the process for the program to work. Somebody had to actually write a code. And if the computer program or the game is quirky, it's not working right, there's some little flaw in it, the computer programmer goes back to look at all the codes, and they look to find where is the misspelling in the code, where's the problem, which code is not working, and go back and rewrite that code. So what I do is I do an evaluation. My evaluation is approximately 2 hours long, and I begin to watch how a person moves. And then I actually will try to test the reflexes in isolation, but you can never really isolate a reflex because the brain and body is connected. So if you affect one reflex, you've tapped into another. But to the best as we can with the specific assessment tests, we'll look and see which reflexes are not as mature, I like to say, or after brain injury have been disrupted. And so I can go back and in a specific sequence, reorganize that reflex code to let that reflex do what it's supposed to do. So a primitive reflex, by definition, is a movement that is made, that is coded in the brain to occur. So I say to, when I work with a new person, I'll say, hey, you know how a baby goes goo goo gaga and their arms and their legs spread out and they move them in and out? That's a reflex. We call it a moral reflex, where the arms, legs, and head all move out at the same time. If you startled a baby, they may move out their arms and legs and cry, and then they kind of bring their arms and legs back in and take a deep breath. That particular reflex is called a moral reflex. Each of these movements, they have specific patterns like that one, but the others have different patterns, but they all have a purpose. And their purposes are, number one, to be born, to go through the birth canal. So if we've used our reflexes to go through the birth canal, we can check box that one and say, great. We use the reflex for that intended purpose. Another purpose is for survival. So once we're out of the womb, that these reflexes keep us alive. And so great. If we're more than a year old, that we can say, check that box. That reflex has done its job. It's kept us alive and it's helped us go through the birth canal. The other reason we have these reflexes is they are like the littlest seed, the first spark of a big skill. So that one code I was just talking about, the moral reflex, that reflex gave us our first breath of life. If we didn't have that reflex, we would have never opened our lungs to breathe. So you can see how that's survival. And you can see how just that strength of the body movements would help a baby move out of the birth canal. But it helps us to breathe. And then that particular reflex grows up to give us emotional regulation. So our listeners out there, I know that being a person that's had a concussion or multiples, I know that emotional regulation is a big part of that. And what do your therapists always say? Take a breath. Take a breath, take a breath, right? So that means that reflex is not really automated. It's not really doing its job, or it's stuck out in life when it shouldn't be, because that moral reflex should have coded our body to be automatic so that we've learned to just breathe, right? It's a skill that we breathe. But when we have a brain injury, that reflex is actually like an orange barrel on the highway. It's slowing us down. It's getting us to have to do things different ways. We have to go an alternate route, and all of a sudden we can't breathe. And somebody actually has to verbally tell us to breathe. And so then your therapist says, take a deep breath, you'll feel better. And you do, because then what happens chemically in your brain is you reduce cortisol, you relax all your systems, and you can see better, actually. Your visual system expands, your periphery can expand, and you can understand the world around you better. So yes, these are neurological codes. There's several of them. They all have specific movement patterns. They all are grow up to be different skills. So another one is called asymmetrical tonic neck reflex. This is a really common one to get reemerged after a brain injury. And in this one, if you turn your head to the right, your brain sends a signal to your right arm and your right leg to move outward or extend. And at the same time, it sends a signal for your left side to bend a little bit. Now, it might be just a little bit, but imagine a kid in a classroom and the teacher makes a loud noise or another kid is disruptive in the classroom. The kid turns their head while they're supposed to be doing a writing project. Now their writing is off the lines because they moved their head and their pencil moved too along the head movement. Or imagine riding a bike, you move your head to the left and you steer to the left instead of keeping your bike straight. Or imagine we're back in our cars driving as adults and we turn our head and all of a sudden our steering wheel wants to turn, right? So that reflex is really important for left-right things. So understanding that information on the right side of our brain connects with the left side of the brain, crosses over, understanding the right and the left side of our body. Sometimes individuals after a brain injury lose part of their visual system, the right or left side, right? So sometimes we can tap into, if there isn't a full, I guess, cut in the brain of the visual field, then we can get it back. And honestly, I have seen, I never promise anything because it's always God's good work, but I have seen people recover from where they could only write half of the clock, for example, on a pretest, but then they get the other side of the clock eventually in therapy. So did they really have a true visual field cut? Or did some of these neurons just not make connections? And once we got them reconnected, going through the natural process of development and just taking it over again, going through babyhood again, is that how they reconnected? So how's that? Does that kind of give your listeners an idea of these reflexes?
Yeah, I think so. That's fascinating. Thank you so much. I do have so many questions, but Kaylee, do you have any questions or comments here? I'll let you talk.
Thanks. Yeah, I did. That was a perfect explanation. I love that. I've heard many different explanations, and that was awesome. But I was curious if you have seen, as you work with people, if perhaps they're in like a concussion type of program, and you notice that their nervous system's ability to handle the stresses of recovery increases, and perhaps their symptoms are decreasing enough that they can. Does that make sense? Their capacity for doing the tasks that they've been given, the therapies they've been given, has increased as you help them work through those reflexes?
Right. So with the capacity to handle life's challenges in a resilient way, absolutely. Because these, with primitive reflexes, and I believe that primitive reflexes are the neurological foundation for vision. And vision to me is the glue that holds us all together, that makes sense of everything we're experiencing in the world. So when we reconnect the neurons and the codes and we rewrite codes, we then feel more relaxed. And neurochemically, we are becoming more relaxed. Our brain is in a better state to handle life's changes. We can see things differently. So the cool thing about, I think, our program that sets our reflex program apart from other therapists that are working with reflexes is that we do tie in the visual system. So it just so happens that when you change the vision, you change the life. And that is a quote from one of the parents that I saw many years ago. Their daughter was born with multiple disabilities. And she said to me, Patty, when I went to OT, and that was awesome. OT really helped my child. And physical therapy, my child wouldn't be walking. And, speech therapy, this was all great. Like every one of our providers gave a gift to my daughter. But when I changed my child's vision, I changed my child's life. And that has stuck with me forever because the visual system, we need it for speech. We need it to guide our hands. We need it to help us to walk. I have a little girl that came to me with one glass eye. She was born with an issue with her mother's blood, and mother's body was attacking baby's body basically, and so she resulted with one very low functioning eye, and the other eye had to get inoculated, and they gave her a glass eye. This little girl could barely crawl into my therapy room. But after addressing the primitive reflexes and getting her to crawl correctly and learning how to use her eyes during that process, or her one eye, we taught her to focus. And we used special lenses and prisms to do that, to change where the light was hitting on the back of her eye. And when she changed how her eye focused, it almost allowed her to expand her connections with the sense of touch, with their vestibular system. So a lens can change the way the light hits on your eye, causing your pupil to dilate or constrict, or to focus up close and in the distance. It's pretty phenomenal when you put a lens in front of somebody's eyes. What automatically just happens in the body, the whole body is automatically changed. And so we got her to feel her body, because she could not feel her body. Once she kind of felt her body, and then she learned these little subtle movements, like to crawl on your belly, you have to know where your hips are. But if you can't feel your hips, that's another reflex called the tonic labyrinthine reflex. It gives us our sense of proprioception and muscle tone. So we had to simulate that one, but we got it. And eventually she was able to stand up and walk without a walker. And then the most beautiful things have happened in the years that have passed since then. They're still part of our practice. They come in every couple of years and they do more therapy. But the little girl, the mom sent me videos of the child collecting Easter eggs out in her front yard, which was on a hill. So she could walk and balance herself on a hill, bend over, pick up an Easter egg, put it in a basket, look around with her one eye, expand her whole field of vision, and see, there's another one. And she would go to it. Later, I got a video of her climbing on a jungle gym. Like, her mom thought she'd never play on a playground. And later, I got her one where she's dancing in a class with other ballerinas. And it's just like, I cannot wait for this girl's wedding day, because I know I'm going to be invited to her wedding, and I'm going to get to see her dance in the future when she gets finds that special relationship in her life. But so all these codes are so important. And it really, when you change the vision, you change the neurology. And when we tap into the reflex code at the same time, and we do this reflex patterns, when we're making a change at the visual system simultaneously, these reflexes become better integrated after a brain injury, or if it's a child, developmentally, we help them get on the right path for life rather quickly.
That's amazing. Thank you so much for sharing that.
I love I have so many clients that come in, and there's nothing better I could do with my life. So I'm grateful to be here.
Yeah, what a beautiful thing. And so when you were describing her being able to do the Easter egg hunt, it's so, those kinds of things are so meaningful, and yet we take them so for granted if it's not an issue, right? Like, it's so simple. She was like, quote unquote, simple. Maybe it's simple, but not easy for a lot of people. And so to appreciate that, to see what that change can happen and allow that child to participate in that activity, I don't know, just like warms my heart so much. I love all of that. So thank you for the work you're doing. And I love that we're going to be like talking about this. And I think, people who are listening to this, who have had experienced brain injuries, or their loved ones, they see that those like tiny little things about a day, being able to participate in activities that are meaningful, that is like everything. And so like being able to do those seemingly little things that are actually huge steps and forward are like, it's such a beautiful thing. So I really appreciate that perspective. And I think before we dive like further in, because there's so much to like dive into here, I think it's just interesting from, again, my perspective in OT school, like hearing about it and knowing that it was related to physical development. Like, we have babies are born with these reflexes. They're generally integrated by the time they're like 6 months to a year, maybe a year and a half. Is that right? And then that should be it. They're good. Like, it never occurred to me that this could have anything to do with a brain injury population, or like helping people rehab and get therapy after brain injury, until Kaylee actually mentioned it, and she had, talked to you. Anyway, how did you learn about that connection, and why does it come back? Why is it an issue with brain injury?
Yeah. So I learned about the connection because I hadn't even really applied it to my own life yet. I had been working with my husband doing visual perceptual evaluations where, we look at how is the brain processing visual information. And one of the tests I would do would be I would have them watch a suspended ball, like a little baseball, and I would kind of swing it side to side, and I would watch their eyes move. And a lot of people, either they couldn't look at it at all, like they would just literally, especially people with brain injuries, they would lose postural control. They would I can't watch that. It's too visually disturbing. So we'd have that kind of, I feel nauseous. If I watch something moving like that. Or they could lock their eyes on it, but every time the ball would swing, their eyes would make a little tiny jump in the middle. And I was like, well, what's that all about? Like, why moving the eyes? Why do they get this little hesitation? And I am sure actually I had that issue too, but I never knew it. Who sits there and watches a ball, and who's going to give feedback to know that that's a problem? So I just had the big why, why? And then, things are put in your life when you need to know. I really, really believe that. So somewhere along the lines, I know I was looking at some old optometry journals. So our ancestral optometrists, they actually looked at how vision is developed and how vision is learned. They weren't just all about giving eyewear, let's fix your eyesight. They were really curious about how do we develop good eyesight and how can we see clearly if our vision goes wonky on us. So I looked up some things that were written like in the earliest of the 1900s, and I found these articles and these doctors who wrote about the birth and who wrote about the early life and the reflexes. And then I guess I connected that dot with what I learned in occupational therapy school, which was at that time the only people that I had to ever think about having reflex issues would be people with cerebral palsy. Those kids, other than that, you don't have to worry about that. And so now I'm going, wow, we've got these reflexes and we've got these people that are normal people, but they've got some of these reflexes that, maybe kids with cerebral palsy have. And so I started reading and learning and reading and learning. And that's when I came upon Sally Goddard's work. And I read her books. I read all of her books, and I could read now, by the way. So I tend to read things that are super important, like the Bible. It was the first thing I worked through, and then I'll continue to do so. And then also just, whatever can help me help somebody else. So I'm reading Sally Goddard's work, and I'm like, okay, so is this a reflex or is it not? Am I seeing this or not? And I really was, but I wanted her confirmation. So I jumped on a plane. I took her courses, and I'm super grateful for Sally Goddard's work as well as her late husband, Peter Blythe. They had taught me a whole bunch of things that I pass on. I stand on the shoulder of giants for sure, and many other optometrists too. So I put it all together that these reflexes are how you learn to see. And that's pretty much how I connected the dots. And so if we go back and we see these reflexes are active when they shouldn't be after the age of 1.5, then we need to go back and rewrite those codes. We need to reintegrate them in the brain. Codes that are needed for survival. That's why they come back after a brain injury. So if our listeners are out there listening and they're like, oh, I turn my head and my arm moves, or I am emotionally dysregulated and I'm not breathing well, or so forth, they think maybe I have retained primitive reflexes. You probably do. And it's really a good idea to go to somebody that can rewrite those codes for them, put them back in place, because those codes came out, those movements came out to save their life. So we need to say thank you. That's God's great work. Thank you for being there, primitive reflexes. I hear you now. I know you're in my life. Let's have this conversation. Let's get the arguments out of my neurology so that I can make peace. And if you just think about a puzzle and you got this beautiful picture and somebody comes and upsets that table and that puzzle falls all over the floor, there are some pieces still connected. They didn't all fall apart. There are some connected, and there are some connected in spotty places. And what do we do to put back the puzzle? We find the pieces, and not all the pieces can be put back right now. Sometimes you need to put other pieces in place first, but we do it. We find the piece that goes next, goes next, goes next, and we don't give up. We take breaks. We walk away. We bring a friend in to help us find some pieces, and we get that puzzle back together, and we can really help our lives improve to a better state.
Oh my gosh. Amen to that. Thank you for saying that. That is so important for people to hear. Like it is doable. It is possible, and it takes time, and it takes breaks, and it takes all of that, and not giving up and trusting that the right thing will come at the right time. I love everything that you just said and really appreciate that. Yes. Amen to all of that. I've been taking so many so many questions to ask you. There's so much that's good here. Kaylee, do you have a question while I'm getting my head straight here?
No, I think that was wonderfully said. So just to clarify, I guess, as far as, so if somebody came to your clinic with a brain injury or concussion and wanted to do this primitive reflex evaluation, you kind of start developmentally, like where it would, like you would start with Moro and then build from there to see like which ones you need to work on first. Is that kind of how that order goes then?
So that's a wonderful question. So I do take in consideration that not everybody can come physically to me. So I can do a remote evaluation for the primitive reflexes. I will often ask for any vision records, and I will often make sure that they get put in touch with a neurooptometrist in their area if they have one. And if they don't, I can help them to get whatever clinical data, and then our doctors can actually see. But it's always best to be seen by a neurooptometrist, and so I help them get that connection. But then I'll do the reflex evaluation either presently in my office, or I will do it telehealth through remote means. And I need a partner, so I need somebody else to assist on their end. And then I will actually not start with the Moro. I will be a good listener. Because you know what? I have found that people, if we just listen, honestly, just listen, let them talk, the answers are just out there. Like they know what's wrong with them, and their words are clues. And I say I'm a clue finder and they're a clue giver, but they tell me exactly how to treat them if you just listen. So I do a lot of listening. I want to hear their story. I want to hear their struggles, and I want to read their body posture. And then if they're able to get on the floor, then we do some things on the floor. But I'll talk a lot about fear paralysis first. So this is the first reflex that gets coded. As far as it's actually not a primitive reflex. It's actually called a withdrawal reflex. And if you imagine a little potato bug or a little roly-poly bug, I think some people call them that, you touch a little bug and it curls up, that's the fear paralysis. So that's a moment where you know it's a good idea to go out and do something, and then you just shut the door. I'm not going. I can't do it today. I don't have enough in me. And you just shut down. So that's our shutdown reflex, our withdrawal. And that starts actually at 5 weeks gestation. So here's my treatment plan. I will do things that occur at 5 weeks gestation. So what happens at 5 weeks gestation? Well, we're swimming in the womb, right? We're just kind of spinning. So we'll do some spinning kind of activities. But again, a person with a brain injury, you can't just spin them. That isn't going to just work. But so I do have techniques to deal with the most sensitive people that I work with.
Okay. So you start with the 5 weeks in. Okay.
Yeah, I start with about 5 weeks gestation, and I address the fear paralysis. And most people with a brain injury have a fear paralysis reflex. So we work to address that.
I was going to ask if you have noticed common themes of people with brain injury, like which reflexes tend to pop out the most.
Yes, there are definitely common themes, I would say, with people who have a brain injury. And of course, it does depend on, I guess, how subtle. So I'm working with a pro hockey player. So we do work with a lot of athletes. And this pro hockey player, I was watching his eye movements. I did this exercise where you move your eyes up, down, left, right, and while you're looking at your fingers stretched out to the sides. And I noticed that the certain area in the lower right gaze, he just couldn't do it. Like, he's like, I can't do this one. So he started to withdraw. And I knew that because he withdrew from the activity that I was asking and he kind of just shut it down, I knew fear paralysis was there. So I said, tell me again about your concussion and how it happened. Can you go back to that moment? And he talked about it, and I said, uh-huh. And so it would make sense that your brain is protecting yourself from looking in that down gaze, because that time that you were looking in down gaze to your right with your hockey stick is when the incident happened. And your brain is saying in the background, don't go there, don't go there, danger, danger, danger. Now you're all healed from, that injury, in the sense of what you could see on the outside. So, great. Your brain is just trying to protect. So let's say thank you to that, but let's have a conversation with our body. Say, well, we're safe now, and the puck is there, and so we need to hit the puck. And so I worked with the fear paralysis. So you may be wondering, how do I do that? Well, I did tell you I use lenses and prisms because we can open up the visual world. The eye is actually made of brain tissue. The back of the eye is the optic nerve, right? Brain tissue. So when we work and we change the brain tissue directly through a prism or a lens, we open that up. But the other thing that I look at the reflex and I say, how is that naturally matured in the first place? Well, the fear paralysis, it's 5 weeks gestation. What's going on in the womb? A lot of skin is getting, a lot of things are going on. The organs are being built. The skin is at the very earliest starting to, form these cells that will eventually become skin cells, et cetera, right? So, and there's a lot of vibration in there, pulsating of mother's heartbeat. So, and mother's fluids. So sound, vibration, touch, and then also emotion. So we know that that the mother's body's emotions can be felt by the baby. We now have that science. So now we got to change fear into joy. And so I made him just visualize this hockey player. If we go back to the hockey player, I made him visualize that a different scene in his mind. So instead, like force a different image. So instead of going back to the trauma image, replace it 4 times. Each time you feel that trauma, I want you to have 4 fantasies of what it did do, because our subconscious mind doesn't know the difference. So we had 4 fantasies of that hit just saved the game, or whatever he visualized. I'm not a hockey player. I let that be his story. So he visualized. So we got some positive emotion. So we did some vibration plate boards. So he stood on a vibration plate. He hummed that while visualizing. So we got internal vibration. And then I brought awareness to his hands. Feel where your hands are. Feel where your feet are. And I made him go into those positions as a hockey player of how he did before the injury. So, which is really great because he got put back on the team. He got released from his concussion and he was able to return to play. And hopefully he'll have no more injuries. But I did have a conversation with he knows that if he gets another injury to the head, his days will be numbered whether he'll play anymore, because the danger of concussion in such an aggressive sport like ice hockey. So
yeah, that's really super interesting. The vibration, the humming, all of the sensory things, as well as the body positioning. That's really cool to like make that connection with where it was all started and inside the mother's womb. That's like super fascinating.
So I find that therapists tend to work at a very high level, but they're forgetting these really, I like to call it the mortar between the bricks. Imagine a bridge being built and you got this beautiful bridge built, but somebody who made the cement forgot to put an ingredient in that cement. Okay? That bridge looks good on the outside, but the structure on the inside is frail and eventually it falls apart, right? So I like to, in our work, I like to go down to the mortar between the bricks and start there. And so if our listeners are thinking, you have listeners out there, I am sure, that don't touch me. Like that sound is too much. I can't process that. Too many conversations going on. So how do we take that sensory overload and really, I guess, lower it to a level that it's tolerated? And often we start by visualizing. So one of the reflexes that I work on is the Babinski reflex. This is a reflex in the foot. And if you touch the bottom of the foot and stroke it from the heel to the pinky toe on the side of the foot, your toes should curl down. Now, in normal life, most of us adults out there, we've lost that because we're in shoes all day. We're not using our reflexes for their intended purpose. So our toes don't curl. They just kind of stay flat. If your reflex was never matured in the first place or after a head injury, then your toes actually would pull backwards. Now, if you imagine you're trying to stand up and your toes are pulled backwards, you're going to lean backwards, right? And our brain is supposed to automatically, whenever we need to, our toes are supposed to curl down to the floor. So one of our exercises is a foot massage to train the foot to how to work again. But there are a lot of people out there that are like, I know they're listening. They're like, nobody's touching my feet. And nobody can. But they're not going to imagine a camera stand, and the camera's is on top of the camera stand, but the feet of the camera are moving. Somebody's taking that camera stand and they're moving the legs of that camera stand, right? Now, what kind of image is going to go in that camera, right? But that's what's happening. If our feet are not doing what they need to do, if the primitive reflex is not acting integrated, then our toes are going to go backwards. We're going to have a loss of balance. We're not going to sense where our feet are. And we're going to be really agitated. We're going to be at risk of falls, right? We're going to have a high anxiety. And we're not even know it has anything to do with primitive reflexes. But the visual world is askewed because of it. So I can't process the sense of touch or the sense of sound. My visual brain can't make sense of that sound or that touch or that smell. And I'm that puzzle all over the floor, right? So a foot massage. And if you can't do it because we're just not there, it's okay. Imagine just the temperature changing on your feet. Start with that. Imagine a feather. Maybe then you take something yourself because you have full control and you touch your feet. And then eventually get to somebody else touching your feet, which is rather an invasive feeling. There's probably people out there who will never get a pedicure because they do not want somebody touching their feet, right? So I hope that's insightful.
Yeah, absolutely. That's so fascinating. And I appreciate you letting people know that it's possible to like build your way up to it. Like you can start wherever you are, and there will be things that you can do to help make progress. And just again, how foundational these reflexes are. If they're out of balance, then it's really hard to get anything else in balance. So it makes sense that we need to start here and get these worked on. I do have, my questions, some of them are coming back a little bit, but if you wouldn't mind just really quickly clearing things up for me a little bit. With Sally Goddard, you mentioned her. What was it that what is her work? What did she teach you?
Yeah, so she works mostly with children and the development of learning. How do we learn? And her work is foundational in that area. And it comes in part from her husband's work, Peter Blythe, who was in psychology and really studied how kids learn, and especially kids with mental challenges. At the time, they did call it mental retardation. So this was back in the 60s. So that's where their work pioneered from. And their work is great for kids that, are having, some learning challenges. But I found that the exercises that they taught me in their program, I modified many of them to include auditory stimulation and visual techniques that are, proprietary to my work. But I took those exercises, and she really just gave me the idea of the exercises, and that there's a pattern to when you should do exercises. And then I think I took all that. Somehow I learned something, not being able to read in college and in school, but I just took my life and I understood what she was saying about children, because I was once a child who struggled tremendously. And I took all of that knowledge of, the exercises, and I put it with what I learned as an OT and what I learned as a teacher, and just, and what I learned just is in vision. And I just, like life just exploded for me. And I have a painting in my office from a gentleman who's an older gentleman who had a brain injury. And you can find this on my website, sensoryfocus.com. But this this picture shows some darkness in the upper left-hand corner with these little human figures, just kind of little yellow figures crawling around in the darkness. And then in this picture towards the center, he's got a heart with string around it, and he's got a sun, like a sunshine. And that sunshine also has it kind of represents an eyeball with an iris, and it kind of represents our logo, which is my husband and I. He was a volleyball player, I was a cheerleader. You can kind of see that in our logo. And then at the bottom in the lower right, there's these mountains. And he says he painted this as a thank you because he got his life back, according to him. And he said, when I came, I was crawling in the darkness. Nobody understood me, and I didn't have friends, and I couldn't communicate. And like, I was not in a good place, in a dark place. And then he went to our practice and he found the light. He found vision. He found the love, and the love mended his heart. And now he's climbing mountains. So just like a beautiful story of how all of this works together to change a life. I have another client that I could go on and on about the stories. I have another client, COVID injury. And so he came to me. It was interesting. So he came after about 4 referrals from another doctor who is an MD in a well-renowned hospital system here in Ohio, which I can't really say because I can't get the person in trouble, because a lot of hospitals have to refer within their network, and they don't. They're very scared to refer out of the network. Well, this person, I was actually teaching a class in Canada at a international conference, and this doctor called me. You got to see this. You got to see this person. You got to see this. He doesn't necessarily need the eye doctor. He needs your reflex program. So the eye doctor said, well, his eyesight's fine. And it was. So I said, by the time this doctor called me, it's like, you got to see, I said, I'll get him in. So I got him in, and I looked at him and I listened, right? And the first thing I do is I listen. And one of the first things he said was his gut health. And I checked his primitive reflexes. They were not where they need to be. He had a big moral response. Well, his gut was inflamed, and he kind of mentioned something about his gut and how he couldn't drive to Canada to visit his brother. So anyways, we did a reflex program. I did do syntonics. Syntonics is a colored light lenses over the eyes to kind of rebalance light frequency. Did that with him, did some cranial sacral work with him, and he got his visual system back. And I think I only worked with him for maybe 12 sessions, and he came back and he had the biggest smile. He's like, I'm alive again. I'm alive again. And I'm like, have you visited your brother in Canada? He's like, I can drive. I can go and see him, and I'm not troubled anymore.
Giving people their lives back is must be a rewarding experience.
But I went to the gut health because that was part of the moral issue. So his moral reflex was not because of the eyes. The reflex was in response to what was going on in his gut. So I had him tested for gut dysbiosis, and we found out that once I got him hooked up with a functional medicine doctor, and once he got that balance of his gut, his moral reflex relaxed. His brain injury from the long COVID improved, and he's got what he called his life back. So I'm happy for him.
That's beautiful. Thank you for sharing that. That's so cool. So it sounds like in part of this integration, so if people are listening, they're like, okay, I want to know how, I want to get checked out for this. I want to know how to get these reintegrated if they're problematic. What advice would you give them?
So I do have, you're more than welcome to come visit us, of course. But you can also talk to your OTs, your PTs, speech and language pathologists, your chiropractors. There are a lot of people that work with primitive reflexes. I do think that it's really important to see a neurooptometrist. I think that's vital to make sure you are in touch with a neurooptometrist. You can find a neurooptometrist through COVT.org. Also, noravisionrehab.org. That's NORAV as in Victor, ISION as in Nancy, REHAB as in boy.org. Those two organizations have locate a doctor, and then you could call those places and say, do you have experience with people who have brain injuries and so forth? Of course, there's my office, and that is sensoryfocus.com, SENSORY, like your five senses, and focus, FOCUS.com, to see if we can help you. But definitely looking at your reflexes. I also have a book that I have written for doctors, teachers, pediatricians, anybody interested in testing. So just with some basic standards. And the book is, I think most of the videos there's little clips, you can go online and see the videos of how to test. They're mostly children in those video clips, but it gives you an idea of how to test for reflexes with some sort of standardized, parameters. So unfortunately, currently there's no test that is objective where I can hook up electrodes and say, you are exactly this or that. It's not like a blood test or a heart rate monitor or anything like that. That is a goal of mine, is to get something created which is objective, but this book does give some insight on how to score reflexes to know if they're getting better. And then finding somebody that can truly integrate reflexes while integrating the sensory systems with vision leading is really important. The vision is the glue. And with vision, there's no, what is it in the Bible? It says, if there's no vision, people perish, right? That vision is super important. That's Proverbs 29:18, if I'm right.
Excellent. Thank you. I love that we're bringing scriptures into this. What was the name of your book?
Indicators of Primitive and Postural Reflexes. So if you look up my name, Patti Andrich, and then Indicators of Primitive and Postural Reflexes, you'll find a link to order the book. I also have a link on my website.
Oh, thank you. Okay, that is excellent. It sounds like the best thing is for people to be seen, to have somebody who knows what they're doing, look at them and make recommendations and do the integration.
Yeah, the team approach is so important. We all know what we know, and we don't know what we don't know. So, and remember, some of those pieces get put in now, and some of those pieces get put in later. So having a team approach that's willing, when you're working with a provider that is like, yeah, I'd like to connect with that person. Yeah, I'd like to work together. That's pretty good indication that they've got your back, and they're not just thinking of themselves, that they're really thinking about you and your healing process. So we can't all do everything for one person. Like, it really is a team approach, and there's so many talented, brilliant minds out there that really have a lot of love in their heart, that are just they're here for a purpose, to help you heal.
Amen to that. Thank you for sharing that. So we've gotten some good follow-up information for people. If they want to learn more, they can go to these places. If they want to learn more from you or work with you, they can go to those the websites that you mentioned, sensoryfocus.com, get your book. And do you want to share your email on here as well?
Sure. My work email is info@sensoryfocus.com.
So if people are interested in reaching out, they can do that way. Thank you so much. I have two questions that are have been on my mind this whole time. So before we let you go, if it's okay, I want to ask you, you mentioned, and maybe they're related, but you talked a lot about imagination and imagery and things like that. I know that was one of the things that was really interesting to me when I first heard this, that the visual system obviously takes care of what we see, but it also is what we see in our mind's eye. If we're closing our eyes, we're not using our eyes right now, but we can picture something that lights up part of the visual system in our brain. And so how does this primitive reflex help with people being able to imagine or dream? I know that, I don't know if that's related or not. People talk about not being able to dream. Anyway, just wanted to bring that topic up and hear your thoughts.
That is true. There are people out there that have lost the ability to visualize or to dream or to see things in their visual brain. Remember, vision is not eyesight. Eyesight is one skill. The visual brain has multiple skills. So eyesight can be fine, but vision can be poor. So let me give you an exercise here of something that you can do, all our listeners can do. And if they're in a safe place right now, just listening, not driving their cars, they can put their palms over their eyes so that they can relax. So just, and if you're wearing glasses, if you could take them off, it would be a better experience. And close your eyes and just breathe. Breathe in and breathe out. Feeling your body, feeling any area you want to go to. So just kind of imagining what would your hands look like? What would what's your left foot look like? And if you can't imagine yours, just think of the word foot, and can you see the letters? Sometimes we can't see things, but we can see letters or numbers. So we're just building the ability to see or feel. And if you can't do that, that's okay. We're just exploring, because over time, maybe we can. Sometimes I'll say, look at the stars. Let's look at the night sky. And let's find some different stars to look at. Some of them are closer than others. Let's look at a star and make it pink or blue. Can you make it change color? So we'll practice making stuff, different stars, different colors. Go to one in the far right, and then maybe go to the one in the far left. I would do this a little slower than on this podcast here. And then I would say, let's visit a star and give it a gift. And don't worry about what your gift is, because the star needs it. You just give it a gift. So you give the star in the front of you, the closest star in front of you, give it a gift, and then say thank you, and then go to another star and give it a gift, and play around with that for a little bit. All this time breathing in and out and feeling warmth around you and feeling love around you. So we do a lot of visualization, maybe with family members, maybe with loved ones that they're around you, and then open your eyes and you can just kind of feel your eye muscles are more relaxed. When your visual system is relaxed, your eyes work better. When your body is relaxed, then the stress hormones decrease. So by moving your eyes to different locations, you're stretching your eyes to move them in different directions, and that's a nice thing to do. So there's an activity for our listeners to practice.
Perfect. Thank you. Thank you so much for bringing something like that they can actually do in the moment. That's awesome. And my last question for now is you mentioned that the visual system is related to speech. And I'm wondering if that's like somehow related to tell me how is vision related to speech?
So when I told you at the beginning of this podcast, I said, I read the work of many of our ancestral doctors, right? So there was a doctor, his name was Dr. A.M. Skeffington, and he created a Venn diagram of how vision is emerging, is how he called it. And he said that first there's this anti-gravity circle in the lower left of his diagram, and that is the baby coming out of the womb, learning to lift its head. And when the baby is on the floor, learning to lift his head, the visual system begins to organize. The baby starts to converge their eyes and focus at different distances. As the baby learns to lift their head more, they focus the distance out and further away. They learn to crawl, to reach a bottle, or to move to attain a goal. So vision becomes very psychological at that point, goal attainment. At the same time, we have this anti-gravity circle. There's a circle he draws above it, and he calls that centering. That's eye movements. We learn to organize our eyes by moving them left, right, in and out. So converging, diverging, up, down, all the movements our eyes make. And then there's a circle to the right of that in the upper area, and that one is identification. And that's not really the verbal part of identifying things. That's just really clearing visually. So making something from blur to clear. So I can identify it if I can clear up the image. So that's the part of the visual system that clears things that we look at. And then the fourth one, and this is the answer to your question, is speech and auditory. So if I asked you to look at something and give me 5 words to describe that thing you're looking at, it might be kind of hard for you to come up with 5 words. Maybe it'd be easy. And then I say, okay, give me 10 more words. Now it's a struggle. Give me 10 more words after that to describe this thing you're looking at. You could be talking about textures, touch. You could be talking about size, relationships, colors, I mean, uses of them, right? So you can come up with a lot of words, but the more you verbalize what you're seeing, the more you're seeing, right? But you cannot verbalize what you cannot hear. We have to hear a sound to reproduce a sound. So in our work, the auditory system is very much important to our reflex work because our reflexes help to organize our auditory information. And after a brain injury, auditory is often something that goes and it startles us all the time. And then that can affect our whole vagal nerve and our polyvagal system, which is a whole nother podcast. But yes. So yeah, the speech and auditory, what can you say about it is super important to vision emerging. And only when those four circles combine together in a therapeutic session does vision really truly emerge to its fullest potential.
That's amazing. So it sounds like, yeah, all of this interrelatedness of the senses is so fascinating and so cool that we can break it down to a place where we can make difference. And I assume that you've seen people make improvements with the noise sensitivity as well as the vision, like light sensitivity, all of these things that can be so like they can stop people in their tracks. Like they can't function in their life if they're overwhelmed by these senses. And it sounds like this would be a good starting place to help reintegrate and allow progress to be made in those areas.
Yes. Yes. Definitely. And I'm so grateful for the work you do. Bethany, you are a gem, and your listeners really, I think that they have gained so much information from the people you've brought on. I've learned things that I didn't know. So thank you for your work.
Thank you. Thank you so, so much. I really appreciate it. Kaylee, do you want to have some last words here?
No, well said. I'm grateful for Patti and Bethany, for both of you. I was curious if there are doctors or professionals that are wanting to learn more and take a deeper dive into primitive reflexes. Would you just suggest that they start with your book and work from there, or where would you suggest they start?
They can also email me and I can put them on a list. I do run courses from time to time. So, and they can email me and I'll put them on a list and let them know when I'm running another course. I can also teach courses for people and groups of people that meets their specific needs. So I do that as well. I do have a question for you, Kaylee.
Yeah.
So prior to starting the podcast, you mentioned that you had contacted me previously to get some insight for someone. And I was just wondering if you could tell the listeners what you learned, how you incorporated some of the things that you've learned either by me or other things with the work you do.
Sure. Yeah. I got introduced to primitive reflexes through vision therapy. I became a vision therapist with a neurooptometrist, Dr. Duvall, here in Utah. He's awesome. And then I started working at a wonderful concussion clinic called Cognitive FX. And there I had this theory. I really wanted to see if I could help patients increase their capacity, their nervous system's capacity to handle the treatment they were doing, and also decrease symptoms at the same time utilizing primitive reflex integration. So they let me, the neuroscientists and people at the time, let me go ahead and work with them with the patient's consent. And we discovered, I would say, we had only been doing it for 2 or 3 months. So, numbers wise, we don't have a huge amount, but I started to notice that about 5 or 6 people out of 10, that would happen. That exact theory would come to pass for them, and their nervous system would regulate. And in that session, they were able to handle more. They actually decreased symptoms while they were doing the exercises rather than things getting way worse, which was really phenomenal. So primitive reflexes have helped me in my own brain injury recovery. And it's just been one of those things I find very fascinating. And there's a lot of multi-sensory tasks to help integrate those that you have talked about so wonderfully. And I'm just excited about all of the primitive reflex work that's out there. So
thank you for all you do. It is a team approach. So it's good to have good people working together and help each other out. And I will say the greatest teachers I have had are my clients that I work with. They have taught me so much. I'm so grateful because I just pass it on to the next friend that I get to work with.
Yes, that's so accurate. I love that. I definitely been so inspired and learned so much from the people that I've been blessed to work with. So I just thank you again, Patti, so much for being here and for sharing all of this. I think I'm like, I have so many questions. I want to bring you back on again if you would be up for that at some point. But this has been so good. I really appreciate it.
Well, thank you so much. Enjoy your day.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.